How's it going, guys? Civilian Medical here. I got the best production quality on planet Earth, which is why I'm having to hit the button and walk around the camera. I'm not quite far enough into this to where I know how to video edit and do all that stuff yet. So look, I'm just a regular old civilian guy. I'm not a former professional anything. I'm just a regular dude who got a little bit of training through a company called Refuge Medical, and I've done a whole bunch of my own research to try to make myself a little bit more medically capable and a little bit more medically informed on how to do life-saving things. So if any of y'all are professional preparedness people or professional medical, throw any comments that you have, any tips, tricks, anything like that in the comments for me. If you hear me talk about anything that isn't quite accurate, throw that in the comments as well. I'm still learning and growing just like y'all. The last thing that I want to do is give anybody bad medical information. So take everything that I say with a grain of salt. I am still learning and growing. I have a relatively decent understanding of medical stuff, but once again, if you have any questions or if you have any concerns or if I say anything that's not quite accurate, correct me in the comments. I'd appreciate y'all. Anyway, so I don't really have a super methodical way that I'm going to go through this, but so if y'all want to get a fully packed out medical kit, IFAK, whatever, that exceeds military specifications and that is extremely well made, check out Refuge Medical, okay? You can use my code CIVMED, CIVMED, all capitals. It'll help me out, it'll help them out. And I want to send them any business that I can because I love and respect that company so highly. They've taught me most of the things that I know and have inspired me most of the ways that I've been inspired to do stuff like this, to get into the medical side of things and just to make videos about it. They've inspired me to become more medically prepared any way that I can. So go check out Refuge Medical. They're an awesome company, amazing people. This is a trauma kit that I built out myself. I've made many of these over the last 4 or 5 years. A little roll of Coban that popped out. Oops. Anyway, it's nothing crazy. This is a Condor Ripaway IFAK. It's got the Velcro on the back. I put some patches on it because I carry it in my backpack. I don't need the MOLLE straps on the back of it on this one. But I'm making this video to teach y'all and make y'all understand the importance of having a medical kit and understanding what goes in one. Okay, I'm not going to get into how to use all this stuff on this video. I'm just going to tell you what goes in a good kit and hopefully convey the importance of you having these things. Okay, so in this little bucket right here, I have the contents of this BearFAK. That's what this is. This is a BearFAK. I have the contents of this BearFAK in this bucket, and I'm just going to go through these things one by one, tell you what they are, what they're for, and hopefully after this video, you'll have a decent idea as to what goes in a good medical kit and why it's important that you have these things. All right, so I'm going to go through these things, I guess in no particular order. So this one, I got this one with 2 tourniquets. These are CAT Gen 7 tourniquets, all right? These are going to be the best tourniquets that you can get for self-aid and buddy aid. A lot of people would argue that for buddy aid, you're going to want something like a soft T because they have a buckle on the back that'll help you get around bigger legs and bigger, limbs and things like that. It'll also help you. A lot of EMTs and paramedics prefer soft T's because of that buckle. If you have somebody that's got an impinged limb, that's, caught between like a crushed door, or if they're under something or whatever the case might be, sometimes a soft T might be better. But I've done most of my training with CAT Gen 7 tourniquets, and I know how to spot a fake one. So this is what I use. I know how to properly stage them. All right, this is how one is supposed to be staged, so that it can just be, so that it can be wherever it's stored, you can pull it out and with one hand deploy this. All right, because in a lot of situations, if you have to use a tourniquet, there's a good chance that you could be missing an arm or a hand. Okay, so you want to be able to deploy this with either hand. Okay, oops, excuse me, just like that, so that you can get an arm in there, it's ready to go, or a leg for that matter. Okay, and you don't have to do a whole bunch of fidgeting with it, messing around with it. That's how your tourniquet should be staged. I'll show you how to actually stage this in a different video, but a TCCC recommended tourniquet, a Tactical Combat Casualty Care recommended tourniquet. The Committee on TCCC is who kind of signs off on a lot of stuff like this. I'm not about to sit here and act like I'm an expert on them. I just know what they are and what the letters stand for. Anyway, Cat Gen 7 tourniquet is something really important for you to have in a kit, so you should have one in a kit. If you don't have the money to buy an entire one of these kits, because I will say they're not cheap, they're absolutely worth every penny, and they're guaranteed forever. So if something happens to the kit, anything, Refuge will replace the kit itself. If it rips, tears, anything like that. Also, too, if you use anything in one of their kits for life-saving, intervention, like if you have to help somebody save a life, they will replace anything in that kit, everything, and including the entire kit itself, depending on what you use in there. But they'll replace that stuff if you use it to save a life. So anyhow, keep a Cat Gen 7 tourniquet with you. And if you don't have the money to buy a whole kit, just buy these items one by one and build your own kit, and save up to buy a couple of good kits as well. That would be my suggestion on that, because for a long time, that's kind of how I ended up here, because I couldn't afford a lot of really good kits at the time that I got into all this, so I had to buy all these components one by one and put my own kits together. Okay, so the next thing that you're going to want to have in there is going to be a pressure dressing of some type, okay, an emergency trauma dressing, an Israeli bandage. This is an ETD, an emergency trauma dressing. This is basically just a big ACE bandage with a huge gauze pad on it, all right? This is going to be used for addressing massive bleeding, just like your tourniquet. I actually didn't talk about this enough. Your tourniquet is meant for the arms and the legs. This is meant to close off major arteries. Okay, you have femoral arteries running on the insides of your arms and on the insides of your legs, and this right here is to impinge that vessel, that bleeding vessel, onto your bone until it closes off that vessel and stops the bleeding. That's what this is for. Okay. Usually, an emergency trauma dressing is going to be for once you've used a tourniquet, or once you've used, where is it? Sorry for the fantastic organization and quality here. But here we go. If you've used wound packing gauze, a lot of times, if you know what you're doing, wound packing gauze and a tourniquet will do the same thing, okay? Wound packing gauze is a large, long piece of gauze that is meant to be packed into a wound, and the idea of this is to put pressure on the bleeding vessel and compress that into the bone, same as the tourniquet, and then fill up all the extra space of the wound with gauze to hold pressure on that vessel that you've just closed off with the gauze, okay? Usually, your trauma dressing is going to be to cover over the top of that to secure that, or this can be for lacerations and wounds that aren't quite severe enough for you to need wound packing gauze or a tourniquet, okay? Israeli bandages are these ones, they have the plastic cleats on them, okay, that you, I'll show you what one of those are in a different video, but the Israeli bandages is what people seem to know the most of, are the most familiar with, excuse me, and they also seem to be, like, the term Israeli bandage, that seems to be the most wide known term as far as these go in the, community. So anyway, you're also going to need an emergency trauma dressing or an Israeli bandage, 6-inch or 4-inch. They're both good. The 6 inches are going to obviously cover more space. And I already kind of covered what this is. This is wound packing gauze. You can use this for a lot of other things too as well, all right? You don't only have to use this for wound packing. Sometimes you can use this to handle a major laceration kind of the same way that you would this. You could use this as sort of a makeshift triangle bandage if you had to, for a sling or, something to that effect. And there's some other uses that this has as well, okay? So we've covered emergency trauma dressings, wound packing gauze, and tourniquets, all right? Another thing that you're going to need is gauze of various sizes in the kit. You're going to want to have yourself a couple to a few of these 4x4s. You're going to want to have yourself some of these. These are a little bit thicker. These 1x2s, like 1 5/8, 1 5/8 by 2 5/8, but I just call them 1x2s. They're a little bit bigger than these. What are these technically? 2x2s. So these are just kind of like a bit of a taller and thicker version of these. All right. You got you have your medium gauze, your smaller gauze, medium gauze, larger gauze pads. These are going to be, and look, I'm sorry if I sound like a total noob that doesn't know what the hell he's talking about. I'm a little bit nervous. This is the first time I've ever talked on camera about medical stuff. So just give me some time to grow. All right. I'll eventually sound a little bit more knowledgeable and concise as time goes on. So anyway, I'm human though, and I'm doing this for the first time. So these are going to be your larger gauze pads, the 5x9s. These are going to be the big boys right here. You're going to be using these for things like wiping off an area to get it ready for chest seals. Okay, you're going to be using these for things like, and you can use these for addressing big lacerations and wounds and stuff like that as well. Gauze is gauze. It doesn't all gauze is not created equal, and it doesn't all address the same problems, but 5x9 gauze pads has a pretty wide variety of applications. But usually you're going to be using something like this in conjunction with your chest seals to wipe away any blood or viscous fluids so that you can get the sticky stuff that goes on the back of these to stick properly over the wound, and that's going to, I guess I don't want to skip over the gauze too much. Gauze is going to take care of a lot of your smaller lacerations. This is going to take care of sort of your boo-boo type stuff, okay? But it's important that you have these because not every single wound that you have is going to be like a big life-threatening laceration. Sometimes you're just going to need some smaller gauze to take care of some other things. These smaller gauze pads as well, they can also act as eye pads or eye shields to go over your eye. If you have a wound to the eye, and also you're going to have something like an eye shield in these specific kits right here that are going to help cover up that eye wound as well. Okay, so your smaller gauze pads are going to be for your tinier cuts and scrapes and stuff like that to clean off things, but as well as something that can go over your eye in conjunction with an eye shield, and that's gonna cover a lot of that. There's some things that I'm probably forgetting about with the smaller gauze pads. If any of y'all know what those are, leave it down there in the comments. But so let's circle back around to the chest seals. Okay, so the chest seals are going to be for sucking chest wounds or holes in the pleural space. That's what we call this right here, the box. Okay, your chest area, that's the pleural space. That's where all your major organs and all that stuff is. We don't wound pack in the pleural space. Wound packing is for junctional areas and for limbs and things like that. You're not going to be, and for the neck and for the neck and pelvic girdle area. Okay, so we're not going to be wound packing in the from here to here. That's what things like chest seals and things like chest decompression needles are for. I'm not trained on how to use those. If you want to help render aid medically to somebody, in most states we're covered by what's called the Good Samaritan Law or the Good Samaritan Act. That basically just means that you can assist with addressing existing holes, but you can't make new ones. So if you're somebody who understands what a tension pneumothorax is and open pneumothorax and all that stuff, which is built up pressure in the chest cavity, unless you're trained medically and have special letters after your name, don't be using chest decompression needles on people because you could and possibly will go to jail for it. So just be aware of that. Anyhow, this is for punctures to the chest area. Oop, didn't mean to rip that. This is meant for punctures to the chest area, for sucking chest wounds and things like that. And we'll get into more of that at another time, but that's what chest seals are for. These are hyphen minis. I like these ones and the full-size ones. I prefer these, though, because they work just as well. They're smaller. You can fit them in a pocket a lot easier. I actually EDC a pair of these, and we'll talk about my EDC in another video. Rolled gauze. one, if not a few of these in a kit are extremely useful as well. This is going to kind of go along the same lines of dealing with smaller lacerations, and these can also be used as a securing bandage, you know what I mean? And in a pinch, if you had to, this is definitely not ideal to use. Let me reiterate that. If you're going to wound pack, you need to have some robust wound packing gauze, compressed gauze, Z-fold gauze, S-roll gauze, whatever, or hemostatic wound packing gauze. That's actually what, I got some of that around here. Quick Clot Combat Gauze. This is hemostatic. This is basically impregnated with small granules of clay. Essentially, this takes your clotting time down significantly. I'm not going to say what the exact time is. I think it cuts your clotting time down by like 1.5 minutes or something like that, but don't quote me on that. Anyhow, this didn't come with the kit. This is just something that I got to put in there extra. You can get hemostatic gauze as an added bonus or as an extra thing in the kit. You just got to pay more money for it. But back to the rolled gauze, you could use, if you have multiple rolls of it, actually, this is like a thicker, more robust version of some rolled gauze. If you had a good few, like 2 or 3 rolls of this, if you knew what you were doing, I think you could probably wound pack with this. This is a thicker, spongier gauze. It'll soak up more, and I think it would do a better job of holding pressure on a vessel if you had to do that. But in a pinch, you could wound pack with rolled gauze. So there's that. You want to have some of that in the kit as well. You want to have yourself a good pair of trauma shears, okay? Trauma shears are important because in a situation where you have to address a wound, you want to be able to cut through any clothing and get things out of your way so that you can see the wound that you're working on, see what's going on with that, and cutting clothing away a lot of times is going to be the easiest way for you to do that. Sometimes these also could be useful in case you have to cut something off of somebody. If you're somebody who does any kind of running and gunning or any kind of, any type of hood rat shit, as Bear likes to call it. If y'all follow Bear Independent, y'all know what I'm talking about. But anyway, me and my homies, we call it goon shit. If you're out there doing any goon shit, LARPing around, if you will, in kit or anything like that, if you got to cut some kit, nylon webbing or anything like that off of somebody, this will cut right through that. They got to be decent shears too. Don't buy yourself some $2 Amazon shears. Get yourself some decent ones. Refuge Medical has good shears. I bought myself a pair of X shears. They're a little expensive, but they are worth it. They're so worth it that I'm going to be getting myself another pair to have a backup pair down the road. But anyhow, get yourself trauma shears to clear away clothing, any debris that might be in the way of the wound that you're trying to work on. All right. And I'm not going through this in any particular order. I'm not going through this in the order of the March algorithm. I'm just kind of pulling these things out of this bucket and talking about them as I go. This is going to be in the same category as your chest seal. This addresses airway. Okay, this is going to be a nasopharyngeal airway or a nose trumpet, nose noodle, whatever. This right here is meant to go into the nasal cavity and down back into the throat to open up an airway to give your patient or whoever it is that you're trying to help a patent airway. And the reason that these are in most trauma kits and not oral pharyngeal airways is because this doesn't enact the gag reflex. So basically that means that you can use this on a patient who is awake and not passed out. You can use an oral pharyngeal airway on somebody who is unconscious or passed out or whatever, but you don't want to use that on somebody who's awake because then they'll try to cough it up and you don't want that. So nasos are the way to go. You can use these on somebody who is conscious or unconscious to reestablish their airway through the nasal cavity. You don't want to use this though if somebody has any damage to the maxillofacial region, okay, to the nose, the mouth, or the eye sockets. And if you see clear viscous fluid draining from somebody's nose, that could be indicative of a TBI, traumatic brain injury. And you also don't want to use one of these in that scenario either, because this is designed to go, here we go. This is designed to go in and down. And if you have any damage to this area inside the nasal cavities or whatever that you can't see, this might go in and up. and that could exacerbate a traumatic brain injury problem, and then you make the problem worse that you were trying to help. So if there's any damage to the facial region, nose, eye socket, any of that, or if there's clear viscous fluid draining from the nostrils, you don't want to use one of these. Next is going to be this burn dressing right here. This is pretty damn self-explanatory. All right, this is going to be to address, you know, burns. Let's see here if it tells you what degree of burns this this can, for burns and scalds, cools and smooths, minimizes skin damage, and it's safe for use on children. Okay, that's fantastic. I've actually never used one of these burn dressings. This comes with the Bearfac and with a lot of Refuges kits, but it's a sterile burn dressing that comes in this cooling gel. Really nice for burns. I don't necessarily know if you could use this on 3rd degree burns. I'm going to do some research on that, and we'll talk about burn stuff on another video whenever I kind of can brush up some of my knowledge on that. But it's good to have burn dressings in your kits. And here in my kit, I want to say I usually keep Zeroform, which is, yep, I keep Zeroform in my kits, which is a petroleum-based gauze dressing for burns and things like that. Only issue that I kind of have with these is that they're real skinny, but I just carry a good few of them. Like in this little stack, I got 1, 2, 3. I carry 4 to 6 of them in one of these trauma kits that I put together, and I haven't had to use any of them yet, but I'd like to think that would be enough to handle, you know, like an arm burn or a leg burn or something to that effect. There's a couple other things in here that I'm going to go into, but I should have covered this at the beginning. This is a pair of gloves right here. I keep gloves in all my kits, okay? You need that if you're ever going to help address a wound situation with somebody, the first thing that you're always going to do is put gloves on, okay? This isn't to keep their wound sterile or anything like that. That's why this isn't in a sealed package or anything like that. The gloves that you're going to put on to assist somebody is going to be to protect you from things like bloodborne illnesses and things like that. This is to protect you, not the person that you're working on. Most of the time, when you're using any of this stuff, the idea is to buy the person time to get them to a higher level of care, which is generally a hospital. And one of the first things that people get whenever they show up to a hospital is broad spectrum antibiotics. So infection and things like that is not going to be at the top of your priority list. The top of your priority list is going to be keeping yourself safe first, getting somebody off the X. If it's a car accident or if it's a, God forbid, a shooting situation, you want to get somebody out of the area of danger, get them to a place to where you can work on them and safely use all this stuff, and then stop whatever bleeding they got going on and do everything that you can to address what their medical issues are. But you got to keep yourself safe first, and that's what rubber gloves are going to do for you. And use nitrile gloves, not rubber gloves, because some people are allergic to latex. So nitrile gloves are the way to go. All right. Next in here, we got a triangle bandage, because these things, dude, there are so many uses for a triangle bandage. It's insane. I'm actually ordering a whole box of these here soon, but these are going to be, you can use this for a sling. You could use this for a makeshift cravat if you, well, I guess this is technically a cravat. You could use this for a makeshift tourniquet. I hate even bringing up improvising tourniquets. That's why I have a bunch of tourniquets, because I just don't like the idea of improvising one. I've seen people try. I've tried to improvise tourniquets before. It just never works out the way you think it's gonna. I've had this conversation with a lot of people, without getting too far off into the weeds on that. Just get tourniquets and learn how to use them, okay? If you absolutely have to improvise a tourniquet or whatever, that's why I wanted to become more proficient with wound packing and things like that, because if you know what you're doing and you know how to wound pack properly, you could use even a cotton t-shirt or a sock or whatever to pack a wound. And if you know what you're doing, you can get the same outcome with that as you would a tourniquet. So I just don't like the idea of improvising a tourniquet, because when it comes to that, usually a plan to improvise with a tourniquet tends to end up being a plan to fail. So Triangle bandage, get yourself one, get yourself a few of them. They have a bunch of uses. You can use these for, like, you could use this for a makeshift gauze pad if you needed to. You could use this to replace a pressure bandage if you needed to. So triangle bandages, they got a bunch of uses. They got a bunch of other survival applications as well. You can use these to filter out large particulates in water and things like that. Bunch of uses. Get some triangle bandages. Fold flat tape, dude. Get you some fold flat tape. If you don't know, look, let me show you some right now. I make my own fold flat tape. You can, you know, Refuge gives you fold flat with every single one of their kits. So, hell yeah, Refuge. But me, I just get, you know those, you know how you get those little, those fake business cards in the, not business cards, like those fake paper credit card things in the mail when, you know, the insurance companies or whoever is trying to send you these, you know, these mock cards. They're like, hey, you know, take this right here and activate it or whatever. Anyway, those little paper cardboard cards that you get in the mail, these dudes right here, I keep them. Okay, and you can take these and get you a roll of duct tape and wrap it around that card. And this one's all bent up because it's been in that kit. I use my stuff. So anyway, but yeah, get you some Gorilla Tape, all right, and wrap you a few spools of that around one of these, or it can be an old card that you don't use anymore. Scrape your information off of it, of course. Make yourself some full flat duct tape. Paper credit card or an old worn out credit card, scrape your info off of it, wrap yourself some tape around it, and you've made yourself your own full flat duct tape. Duct tape, as the big homie old Bear says, this sticks to blood, sweat, and tears and everything else. I mean, and what the hell can we not, what do you know that can't be fixed by duct tape? A lot of stuff, by the way. Anyway, so full flat duct tape, super useful, definitely has its medical applications. Next is going to be this emergency blanket. Why? Because this is going to be for your patients who have lost a lot of blood. Yeah, it's got survival applications, but that's not the context of this in a medical kit. The context of this in a medical kit is when people lose blood quickly, they get cold. All right. People have been known to actually get hypothermia on 90-degree days because they lost enough blood to make them cold enough to get to that point. So if your patient's lost a lot of blood or somebody that you're helping to work on has lost a lot of blood, they're going to get cold. Something like this is going to help keep them warm, okay? I always have one of those as well in my kits. Emergency blanket for medical stuff. All right, keep an emergency blanket in your medical kits. Alcohol prep pads. What do I need to explain about these? They clean stuff off, okay? They clean off wounds, instruments. Keep yourself some of those in there. And then here is some tape. Some of this is like clear medical tape. Me personally, I prefer cloth medical tape. This stuff is really good too, honestly. I used to actually kind of hate on this stuff, to be honest, but it rips real nicely and it stretches a little bit. I don't know why, but I used to not like that. Anyway, this tape is really good. It's got a little bit of a stretch to it. It does break apart relatively easily, and I think that was always my biggest problem with it. But if you're wrapping something with this, it works just fine. It does do its job. But me personally, I'm a big fan of Coban, cohesive wrap, you know, cling wrap, whatever you want to call it. This stuff, the stuff that they wrap around your arm after you give blood at a blood bank or something like that. And then cloth medical tape. These are my two favorites right here. Obviously behind the fold flat duct tape. The cloth tape is, I mean, just listen. You hear that tear? This shit is strong. I mean, it's really not going anywhere. It can secure some stuff. You can use this to wrap a limb if you've used a splint on somebody to secure a broken limb or something like that. This stuff's real good for that. It's good for securing wound dressings. I mean, there's not anything medically that you need tape for that cloth tape is not going to be able to take care of. I love this stuff. So I keep a lot of that around, and I keep a lot of Coband around. I keep a lot of Coband around because it's real easy to use. You can use this for securing splints. You can use this for wound dressing, securing, all that stuff. But the other thing that I like about this is most of it doesn't have any the elastic in it doesn't have latex in it. That's the word I'm looking for. And that's something that I got to be a little bit more aware of because my lady is, she is allergic to latex. So that's something that I got to be conscious of. So a lot of times in some of these tapes and things like that, some of the adhesives or whatever, they'll have latex in them, and that's an issue for her. So Coband is going to be kind of good for the same reason that nitrile gloves is better than rubber gloves, because it doesn't have latex in it. Some people got latex allergies, so just be aware of that. So look, guys, that's kind of a quick glaze over. All right. Oh, this is another cool thing. This didn't come with the Refuge kit. This is something that I came up with, I think probably a year or so ago. I thought it was a really good idea. This is also a good medical idea or invention, if you want to call it that, for doing tactical cool guy stuff. I call this the gauze mag. So this is basically just four packs of wound packing gauze vacuum sealed together. And this is about the same size. It's about the same size and form factor as an AR mag. Okay. So this is going to fit in your chest rig pockets. And oh, look at that. I got a chest rig just laying down there. How about that? So this is just one that I don't use anymore, but it'll fit real nice in a mag slot in a chest rig. Yeah, there's a little bit of space on that, but you can always hit the old twist and tuck method with these little straps right here. Anyway, the whole idea of this was to be able to fit this in a gauze mag slot of a chest rig, or a mag slot that would, I want to say I got one up here. No, I don't. Anyway, so that you could fit this in the slot of a mag slot of a chest rig or a mag holster on a belt. And I like this. But on my, the way that I run this on my Refuge kit, on my Bearfac here, the inner, oh, by the way, this inner is so dope. It's got this big red tab on the top. So when it's in the bag, because it fits really tightly in the bag, I'm not gonna lie. It fits in there so tightly that it's kind of difficult to get it back in the bag. We're not worried as much about that. We want to be able to deploy it in a quick hurry. So with this right here, you can do that. When it's in the bag, you just grab that top handle and yank it out and it's ready to go. But there's this big stretchy band at the top. Elastic band. Sorry, my brain stopped working on words for a second. And I just put this old gauze mag right at the top of that stretchy band, and it just sits right on top of the kit. So I pull it out, and that's 4 more packs of wound packing gauze ready to go. And I am a big proponent of carrying extra wound packing gauze, because I know how to use this stuff well enough to apply it in several different areas. I might sound like a dummy who doesn't know anything about anything at some points in this video, but I do know a couple of things, and I'm confident enough in my own abilities to where I know I can use that for lots of different things. I have used that for lots of different things. Anyhow, I'm just a little bit, nervous doing these videos for the first time. I'm still getting used to talking to the camera. Anyhow, guys, I hope this was helpful. Y'all need to have medical. Y'all need to have medical, and you need to have medical capabilities. It's not enough to just buy all this stuff. It's almost more important that you get training, okay? Because if you have training and you have understanding and knowledge on how to use these items, it becomes easier and easier for you to be able to do things on the fly, how to makeshift things, or how to maybe even improvise stuff in a pinch. I always suggest that you have the equipment so that you don't have to improvise for it. But if you have the knowledge, it'll make everything else that much easier. And also, the last thing that you ever want to do is be in a situation to where you have all of these things and don't know how to use any of it. That's the worst thing, because there is nothing that's going to make you feel more helpless, and nothing that's going to be more of a violent reality check than you having paid for all of this stuff that you thought made you prepared, but you didn't practice with any of it and didn't learn how to use any of it. And now you have just created a situation to where you're the problem that could have been the solution. Don't be that guy. Don't be a liability just because you have things and didn't learn how to use them. Learn how to use your shit. All right. So anyway, I hope this was helpful, y'all. That's all I got for right now. Y'all stay prepping, stay ready so you can be more capable of saving a life. See you later.